Imagine getting on an airplane, going somewhere, staying at a hotel for a week, getting on that airplane, coming back, and then getting the bill later on to find out how much everything cost. It's completely absurd. And that's how our system works. Just going to leave that there with you. Heyo, this is Dr. J. Mack Slaughter. Welcome back to the channel. Today we're going to be doing a blind react to a video that is the real reason American healthcare is so expensive. All right, and here we go.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive. If you look at the data on physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries.
This is so true. Pause. People are so afraid to go to the doctor in the US because we're afraid of the crippling debt that we can accrue by going to the doctor, which actually creates a really bad cycle in the long term that will lead to an accumulation of more chronic diseases that lead to more requirements from, the healthcare system as far as medicines, hospitalizations, etc. So what is a kind of cost-saving approach from the individual ends up being a very, very costly approach in the long term.
Doctor more than the Germans or the Japanese. In fact, we go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever. In America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance like Medicare or Medicaid is often the lowest price. These groups, they cover so many people.
Pause. One of the reasons why it's so expensive is because in every other purchasing experience that a US citizen has, you walk up, you see different options, and you choose the option that is the right decision for you, economically, for yourself and your family. There are a lot of factors that weigh into every purchase you make, but the economics of it is something that weighs heavily, And you don't have any idea how much anything costs when you go to the doctor, when you go to the hospital, when you're even getting a surgical procedure. Nowadays, sometimes they'll give you a rough estimate, but really it's this black box. You get the procedure and then you find out months later how much it costs. Imagine getting on an airplane, going somewhere, staying at a hotel for a week, getting on that airplane, coming back, and then getting the bill later on to find out how much everything cost. It's completely absurd. And that's how our system works. Just going to leave that there with you. Pressing play.
That the government can demand lower prices from hospitals and doctors, and they get those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge uninsured patients
So I'm not uninsured, but guess how much this doctor pays in insurance every single month? I pay $1,800 for health insurance for myself, my wife, and my 3 kids. We're all healthy. We essentially never have any sort of procedures or hospitalizations, and we pay that much every single month. And part of that is not because I'm uninsured, but because I'm not in a risk pool with a ton of other people. I'm basically by myself. I'm not with a big group that can then kind of diffuse the risk. So insurance companies will ask for less in monthly premiums. So Think about that. Everybody's like, oh, yeah, it must be good to be in the healthcare system because you can pull all the strings and have much cheaper healthcare. Not the case. Doctors, nurses, anybody who works in the hospital, we're all getting slayed or should I say slaughtered in prices as well. I don't know if you knew, but my last name is Slaughter. I'm Dr. Slaughter. What the hell? How is that a thing? Okay, pressing play now.
4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem. Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor. And so then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the customers, it's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
I'm going to make him an offer he can't refuse.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power.
Pause. Yeah, imagine being unconscious, you're, septic, your blood pressure is extremely low, or you're in this crazy arrhythmia and your heart has this crazy beat and you're not thinking clearly. In fact, yeah, you may be completely unconscious, completely unaware of what's going on. And somehow in that moment, you're supposed to determine what hospital that you're going to where your insurance company pays for everything. First of all, that's not a thing. There's no one hospital that you can go to in the US where you can guarantee that your insurance covers everything in that hospital, because the insurance will cover like one doctor's group. So like it'll cover your emergency physician in the hospital, but it won't cover like labs and, radiology images, or, it'll cover the surgeon at that hospital, but that insurance won't cover the anesthesiologist that put you to sleep. It's completely absurd, and it's so absurdly complicated, and it makes me sad.
You are not usually capable of saying no. You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries, the government is a person who can say no for you, who can say, no, that's too expensive, you're gonna have to lower your price, because they do have that power.
A new push for single-payer health care right here in the U.S.
Single payer! Now!
California and others are saying maybe we should adopt the European model.
If we decided to create a single-payer system with one of these huge price lists in the U.S., there'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single-payer system that is expensive, even as expensive as our current system. It all depends on how much you negotiate down the prices. And now in America, these groups have so much power because they are so rich that it's really hard to get them to bring down the prices. This is the irony of American healthcare. It's so expensive that it's become hard to make it cheaper. All that money they make, that becomes political power. And years and years and years of overpaying, those are huge industries now. And they have a lot of influence in Congress.
Pause. I said this in a couple of my other videos. I'm going to mention this again. Look at who is able to control healthcare. It's not the doctors. It's the hospital systems. It's the insurance companies. It's all of the middlemen, big pharma, etc. It's not the doctors. It's not the nurses. So when you are frustrated and angry at U.S. healthcare, don't direct that at the providers that are at the bedside with you, because we have terrible insurance too. We're hurting just like you're hurting. And we ultimately got in this because we want to help people. And we're all disheartened. And you see it on the news all the time. There are mass exoduses away from healthcare. And this is one of the reasons, because it weighs heavy on our conscience that we're there wanting to do good for people, and instead we end up putting people in crippling debt.
Under a single-payer system, if we did drive prices down, doctors and hospitals, they would be paid less than they are right now. That might mean some of them close, or some go out of business, or some move. It would be really painful. One person's waste is another person's essential service or local hospital or their income. But then single payer, it's not an all or nothing choice. For instance, there's a really interesting section of Bernie Sanders' Medicare for All bill where he lays out this interim plan. It's a plan he wants while he's setting up his new single payer system. And in that plan, he expands Medicare to cover vision and dental, and he opens it to nearly everyone, not just people 65 and older. All kids go on Medicare automatically and most adults can buy in. That plan on its own, it wouldn't get American healthcare spending far down overnight, but it would at least begin to recognize what we already know and what most other countries already do, that healthcare is one of those things the government can do cheaper and better than the private sector.
All right, great video. I dug that. I do not claim to have any answers as far as, how we're going to fix our effed up system here in the US. But I will say, as different options are presented to us, we need to be very, very aware of the fact that tax is a scary thing, right? Nobody wants to get taxed more, but think about how much you're paying right now for your health care. Think about it. If I'm paying $1,800 a month for myself, my wife, and my 3 kids, and we're all healthy, and then on top of that, anytime we need to pay for anything in, the healthcare world, I'm paying deductibles, I'm paying all of this stuff. I have to hit these certain limits out of pocket before bluggity, whatever they do to trick me into paying a ridiculous amount and having them not pay anything at all. I bet you that is going to add up to less than I would need to be taxed every year for some form of governmental intervention. And I bet that number for you will be less as well. Again, I don't have all the answers, just planting seeds here. Dr. J. Mack signing out. Make sure to subscribe.